Today I'm going to discuss importance of postural correction. So myself, Dr. K. Shovan Babu, I'm a physiotherapist, posted at SAI NCOE Aurangabad. So the main importance of postural correction is that so many athletes are generally having a very good fitness, even though so few people have got some muscle tightness and less flexibility. So for them, so it is better to do a postural correction. So I'm going to start about normal definition of posture. So what do you mean by posture? Posture can be defined as the relative arrangement of different parts of the body with line of gravity. If you take the different parts of the body, like you can say foot is a one segment of the body, leg, thigh, pelvis, and trunk and head. So these are the different segments of the body, but they are aligned. They are aligned in close relation to with each other. So that can be
Sorry
defined
to
as a posture.
disturb, Dr. Shoban. Your voice is lacking. I guess there is problem with your bandwidth. So you can switch off your camera and then you can do it. I guess that will be better.
Yes, ma'am. Am I audible now?
Yeah, you're audible. Yes, you're audible. Thank you.
Yeah. Okay. Okay. Sure. So what I'm discussing is posture. Posture can be defined as the relative arrangement of different body parts of the body with line of gravity. Like if we say different arrangements means like a foot is a segment, a leg is a segment, thigh is a segment, pelvis is a one segment, as well as the entire spine is one segment, then followed by the head. So these are the different segments of the body, but they are aligned with each other. They are stocked on top of other. So in order to maintain a proper line of gravity with each other. So that is how the posture can be defined. But posture generally, so generally there are two types of posture. So one is a static posture, another one is a dynamic posture. Static posture is nothing but the segments are aligned and maintained in a static way. Sitting is a static posture, standing is a static posture, sleeping is a one type of static posture. So these are kind of examples for the static posture. But when it comes to dynamic posture, the body is in a continuous motion.
Sorry to
Okay. Am
disturb
I
you
audible
again.
clearly
Yes,
now?
you're audible, but your slides are not like visible. So can you just check that once?
Is it okay, ma'am, now?
No, it is not. I can only see your front, like the starting slide. So I can't see the next slides.
Now?
No, Shobhan. What you can do is like exit once and then you can again start the screen share. I guess that will work.
Now,
Yes, now it is. Now we
now
can
is
see.
it visible, ma'am?
Yes, now it is visible. Thank you, Dr. Shobhan.
Oh, okay, okay, ma'am. So here actually, here so much network issues there. Actually, our center is almost out of the city too much. So, but I'm trying my best. Okay. So I'm speaking about different types of posture, static and dynamic posture. So what I mean by static posture? Static posture is nothing but segments are aligned and they are maintained in a static way. Like if you say sitting is a one kind of static posture, standing is a one kind of static posture, sleep is a one kind of static posture. There are different types of derived static postures are there. So those are all nothing but they are maintained with each other in order to maintain a proper body position. Like I say dynamic posture, like dynamic posture is nothing but the position of the body is in a continuous moving motion. Like you can say walking, running, you can say sprinting, any kind of sport activity coming under dynamic postures. So before going into the little bit depth of the posture correction, so let me give you a brief introduction about the biomechanics of the posture. So how does the posture is going to maintain? So I think you guys like being a coach and all those are attending this class, scientific staff and support staff. So they might be already have some idea regarding the line of gravity, center of gravity, and base of support. So what do I mean by line of gravity? Line of gravity is a kind of a vertical line which is passing through the body towards the ground. So whenever the line of gravity is close proximity to the segments of the body, then only that particular joint or segment is in a proper posture. So center of gravity is the point where entire object of the mass is situated very close to that weight. For example, in human beings, so the center of gravity is very close to the S2 level. So as the person is very taller, so the center of gravity can be shifted a little bit higher. So it can be differ depending upon the position of the human being. Generally, in a normal anatomical position, center of gravity is approximately at the S2 level. So when you take the base of support is nothing but how much the person is supporting the area of the surface of the earth. Like when you are standing with a wide support of your feet, then the base of support is going to become a very large. As if you are standing in a single limb, like single limb standing, the base of support is very going to the base of support is decreasing drastically, so which make you unbalanced. So these are the common terminology before I'm going into a deep dive of the posture. So you can see here, so this is the first the diagram A is showing the center of gravity, so how it is falling in between the base of support. If the line of gravity is falling within the base of support, the person is going to be very stable. Otherwise, if the base of gravity is falling away from the base of support, the person is become very unstable. So second, you can see, so when the person is just changing the a little bit, so as you can see, the line of gravity is going a little bit away from the base of support, so which makes the person unstable. So unless and until he has a good stability, like you should have a good balance and coordination, good neuromuscular control. So these are all the things which makes the person very stable. So as you can see the pictures which the diagram see, so as the person is bending towards the right side, so towards the left side, sorry, so the center of gravity almost is going away from the base of support. So still the person can maintain this position for a short period of time if he is a very athletic person, but as a normal person cannot maintain this posture for even a few seconds, so which makes them vulnerable to lose the balance. So as you can see, the base of support, how the base of support differ from individual to individual. So here is a small child, small kid. So the base of support is going to be little bit higher because the entire weight of the child is going to be situated more on the top of the body. Upper trunk is more weight on the upper trunk of the child. So when it comes to the bodybuilder, like a adult human being, a male adult human being, it is almost equal to S2, like you can say S1. So but when it comes to the females, so for most of the female, the weight is going to situated around the waist and thigh region. So that is how the base of support is going to, as far as the center of gravity is going to situated there. So you can see few diagrams here. So it is a different kind of positions, how the your line of gravity is aligned with your base of support. So like whenever you are in limits of stability position, so like your balance is going to be very unstable, and it will make you vulnerable to loss your balance. So when you bend forward, so that is how you are going to change your line of gravity away from the base of support. So these are the few things. So correct posture is the position in which minimum stress is applied to each joint. So whenever the person is maintaining proper anatomical position with good posture, so you are going to put very less stress on your joints and muscles. So the bad posture do not always cause symptoms, but over the time they may do so. Like whenever, like if few people may have forward head posture, few people may have more lumbar lordosis, but they don't have any symptoms. But if they do maintain this position for a prolonged period of time, so they may be vulnerable to have pain. So eventually the forces are going to alter the entire line of gravity, and the center of gravity is going to alter with this bad posture, and they can make the person to have injuries. Like whenever the person is having some kind of, you just think that a boxer is having more kyphotic posture and rounded shoulders, but if he is maintaining that posture initially, so he's not having any symptoms, but down the line, so he's going to have some problems at the shoulder, and some he may be having some strains at the upper back region. So because of, so all the muscles on the posterior part is going to get elongated. So if he's that he is using that elongated muscles more and more, so which is eventually going to cause some strains in that region. So that is how bad posture may not always cause symptoms initially, but down the line, but it causes some problems. So generally, bad posture causes soft tissue imbalance. So it should be corrected before you start professional training. So when it comes to athletic population, so it is better to do some kind of postural evaluation, so that they may not be prone to have some kind of issues. Like you can say at lumbar region, if the posture is not good at the lumbar region, so they may be having some kind of pelvic problem, back pain may be coming. So if you have not to other problems like hip pain, discoid pain, you can say muscle tears, muscle catch. Okay. So hip issues, knee issues. Okay, not only hip issues. So entire kinetic chain is going to affect it. The good posture requires muscles that are strong, flexible, and easily adaptable to environmental changes. Normally, whenever the person is in a good posture, so it requires the muscles to have a good, flexible muscles, and at the same time, the muscles need to be very strong, and the muscles also easy to adapt to the environment in which you are training. So generally, the bad posture can lead to deformity. Like deformities are generally two types. So postural deformity and structural deformity. Postural deformities are nothing but like the person is having poor posture, so it can lead to small problems. As I said earlier, that poor posture can cause pain. Okay, so those kind of things, muscle imbalances and all. But structural problem is by birth only. Few people have uh, problem at the muscles, problem at the joints. Okay, so these are uncorrectable things, which already makes the person to have more problems with the posture. So these are the things which can be corrected by the orthopedic surgeon. Which can be seen by higher levels. Like you can say congenital abnormalities, like the person already having some problem with the bones of the neck, some problem with the bones of the back or knees, genu varum, genu valgum. So already these are the some kind of congenital problems which can be acquired, which can be developed in fetus of the mother womb. So you can see, so as you can see, there are different types of posture here. So this is the diagram. So first thing is the sway back posture. Second is the lumbar lordosis. Third is the thoracic kyphosis. Fourth is the forward head posture. And final one is the good posture. So what is happening? So when you see the good posture means you have to take a line. There is a rope, so which has to hang it from the top of your ear lobes to the lateral part of your feet. Exactly, there is a part called lateral malleolus. Lateral part of the bone. There is a bump on the lateral part of the bone of your foot. That bone is called lateral malleolus. So you have to drop a rope from the middle part of your ear until to your lower part of your feet. So which is determines how your posture is aligned with each other. So if you see, that is how a good posture looks like. But when it comes to the forward head posture, as you can see in forward head posture, so the head is protruded more forward. So this kind of posture can be seen more in population, like those are sitting in front of chairs continuously. Like nowadays, all the sports like athletes are also using phone continuously. So they use like forward bending repeatedly over a period of time. So which can cause some neck pains. Like already we are having this posture for a period of time, and still they are playing games, but sometimes they may prone to have some cervical neck pain, some back pain, because that part of the muscles already getting elongated, and which makes them to lose some elastic properties, so which makes the muscle to become more weak. So already if you are playing with a forward head posture, so already the muscles on the back part of your neck are weak, so which make you to have some muscle strain. So eventually the person develops some more on the posterior part of the neck, and he may have other problems. Like it may lead to, you can say, disc problem as well. It can lead to pinch nerve as well. It can cause kind of thoracic outlet syndrome. Like there is a vascular problem as well. So like not only that, so it leads to so many other problems. So it is better to get evaluation, so before it is becoming very serious. Next posture is a thoracic kyphosis. In thoracic kyphosis, as you can see, there is a hump posture at the thoracic back region. So here entirely the back is become C shape from back to front, so which is putting more pressure on the back region. So the athlete who is having this kind of kyphosis is more vulnerable to have shoulder problems, especially shoulder and neck problems. So which is also causing rounded shoulders. Rounded shoulders are nothing but the internal rotated shoulders. The shoulders are rotating inwards, and which is make them, which is causing them to have a decreased pressure at the shoulder joint. So especially if you take the thoracic kyphosis posture, the front part of the muscle, chest muscles are becoming very, very tight. So as you can see, like pectoralis major and pectoralis minor. So those are the, like you can say, shoulder flexors. So those muscles are attaching to the posture. Pectoralis major is attaching to the humerus, arm bone. So this is your arm bone. And if you go to the back side, there is a scapula bone. Pectoralis minor is attaching to the scapula bone. So whenever these two muscles are tight, they will pull the scapula and humerus close to the pectoral muscles. So that is how the space between the shoulder joint is going to decreases. There are few tendons, like there are few muscles, like you can say rotator cuff muscles, which are going through that space. So which will cause the shoulder joint to become stiff, and which decrease the space in the shoulder joint, and the person is eventually develop shoulder pain. So you can see the person who is having shoulder pain, you might check that those athletes may have some excessive thoracic kyphosis, like the postural muscles, like backside of the upper back muscles, especially thoracic muscles, may get weak. Especially you can say rhomboids, scapular retractors, you can say trapezius here, especially middle trapezius and lower trapezius are becoming very weak when compared to the upper thorax, upper trapezius. Upper trapezius, you can see, especially below the ear. So there is a muscle, upper trapezius. As a being a coach, I think you might have aware of upper trapezius trap. So that muscle is becoming very, very tight. So that is how the upper here, the person is going to develop there is some kind of muscular imbalances. So here in our terms, we can say some upper cross syndrome. Upper cross syndrome means, especially in thoracic kyphosis, the person is going to have some muscle tightness in the proximal neck and muscle weakness in the lower neck, backside of, I'm talking about the backside of the neck. So upper neck flexors are become weak, lower neck flexors are becoming tight. Whereas coming to the extensors of the neck, the upper neck extensors are becoming tight and lower neck extensors are becoming weak. So like opposite way. So this is how the muscles are going to become weak. So it is called upper cross syndrome. So that is how the person is going to develop some muscular imbalances. So you need to identify, you need to incorporate few postural correction exercises. So here is the best thing is that you have to strengthen the shoulder retractors, back scapular muscles, shoulder retractors you should strengthen, as well as you should strengthen the middle fibers as well as the lower fibers of the trapezius. And you should incorporate stretching to the upper trapezius, as well as you can strengthen the serratus anterior muscles and rotator cuff muscles. That is how you are going to maintain a good posture in the neck. And as well as you can maintain some chin tucks. That means chin tuck is nothing but you have to pull the chin backside and it should lift up. So that is how you are maintaining proper posture at the neck region. So that is how these are some kind of postural correction exercises. Again, I will be reviewing in the final stage how to correct thoracic kyphosis uh, to abolish uh, shoulder problem as well as neck problems. So now come to the lumbar lordosis. Here, lumbar lordosis, as you can see, the person is having more anteriorly rotated forward pelvis. The pelvis is rotated more forward. Okay, anterior means forward, rotate, tilt means rotation. Both pelvis are rotating anteriorly. You can see, so the back of the this person in the lumbar lordosis is elevated. So the spine is developed more arch in the lumbar region, whereas the both pelvis are rotated forward. Both pelvis are rotated anteriorly. So this is called anterior pelvic tilt. So normally the degree of anterior pelvic tilt is around 4 to 10 degrees. But if it is more than 10 degrees, you can say it is anterior pelvic tilt. Few people may not have, even they are having anterior pelvic tilt, but that is okay. But eventually, in severe cases, few people are having. But as of now, the research is saying that lumbar excessive lumbar lordosis in association with the pelvic tilt not causing much problems. But still, as a being a coach, as a being athlete, you have to aware of these postures and you need to correct the problem. Like here, what will happen? So especially in lumbar lordosis, the hip flexors are going to become tight. So like there are, you can say, the sartorius, rectus femoris, okay, and iliopsoas. So few muscles are there. So these three muscles as well as the quadriceps muscles. So these are going to become tight in the front region. If you take the backside muscles, hip extensors, the gluteus maximus, hamstring, okay, so these muscles are going to become weak. So you have to, it is like a, here also you can say, so in our physiotherapy pedagogy, so this term is known as a lower cross syndrome. So here the lower back, especially the lumbar extensors are going to become tight. So like erector spinae, as well as small muscles of the lumbar spine, like multifidus rotator. So these muscles are going to become very tight in the lumbar region. So that is how, so you have to strengthen the muscles which are becoming very tight, very weak. Like here you have to strengthen the gluteus maximus and hamstring backside. This is a posterior chain musculature, so you have to strengthen. Whereas in the front side, hip flexors, you have to stretch the hip flexors and you have to stretch the lumbar, lower lumbar region, like lumbar extensor muscles, as well as when it comes to front side of the abdominals. So the entire abdominal muscles are becoming very weak in this lumbar lordosis posture. So as already the pelvis is rotated anteriorly, so which is cause the pelvic muscles are more lengthened. So that is why you have to be more focus here about the core muscles. Core muscles are very, very important here. So you should strengthen the core muscles. You should stretch the hip flexors, as well as you should strengthen the gluteus maximus and hamstring muscles, extensors of the hip joint. And you can stretch the lower back muscles, especially those are erector spinae muscles. Like you can say, as you can see, like there are deadlifts are there, like some dead box exercise are there, like some planks exercise are there. You can say pelvic bridge, single leg pelvic bridge. Okay, all these are some of the exercises which you can incorporate in your training so that you can avoid lumbar lordosis. That is how you can maintain some good posture. So there is also another posture like sway back posture. So what will happening in sway back posture? The person pelvis is shifted more and more forward position. So here, excuse me, here the pelvis is shifted more anterior, more forward position. Here it is not going to tilted anteriorly or posteriorly, but it is shifted little bit forward. So it is also kind of abnormal posture when it compares to a good posture. So but so here what you can see, so there are few changes will be here. So you have to develop a flat back posture. The thoracic region doesn't have much lumbar lordosis, as well as the lumbar region also doesn't have much lumbar lordosis. They have mild decreased in curve in the thoracic as well as lumbar region. So so it is how this posture can be identified by a good postural analysis. So these are kind of different postures which you can see in this diagram. So you can also see some kind of diagrams here. So this is the good posture. So how the line of gravity is tracing from ear lobes until to the lateral part of the feet. So in anterior pelvic tilt, the pelvis is tilting anteriorly. The pelvis is rotating anteriorly. So in third picture, the pelvis is rotating posteriorly, which is called posterior pelvic tilt. So you can see different types of postures, how the line of gravity is passing through in relation to the different segments of the body. So you can see already have talked about these types of posture. I'm just showing the diagram. You can see. So as you can see, these are also different types of postures. So the lines which are passing from the top is a line of gravity. So how your line of gravity is passing in relation to the segments. So see the good posture. So how the good posture is aligned. So relaxed faulty posture, kyphosis. You can also say kypholordotic posture. This is a sway back posture. Sway back means the entire pelvis is shifted forward, but it is in a mild anterior rotation of the pelvis. This is a flat back posture. In flat back posture, the lumbar lordosis, the curve of the lordosis is decreased, as well as the thoracic kyphosis also going to get decreases. So round back posture. Here in round back posture, the shoulders are rounded more anteriorly and the knees are extended more backward, which is called hyperextension of the knees, which is also kind of wrong posture. So which can be identified by good postural analysis. And you can incorporate some, so you can find out what are the tight muscles and what are the weak muscles. So according to that criteria, you have to use the exercise therapeutic protocols to strengthen them and avoid long-term problems. So as you can see, these are the kind of syndromes: upper cross syndrome and lower cross syndromes, as I've spoken previously. So this is how the muscles are. These are the in red color. Those are the muscles which are going to become tight, and in blue color, those are the muscles which are going to become weak in a crisscross position. So this is how the person is going to develop most problems at the neck region as well as in the lumbar region. So these are some of the kind of postural problems. So when you see the person from the lateral view, from side view, so they may develop some different kind of postural problems. So which can be started from toe to head region. So in toe region, you can see clatos. Clatos are nothing but some kind of curled toes, hammer toes, flexed knee posture, hyperextended knee. Like you can say genu recurvatum. Hyperextended knee means the knees are going backwards, like excessive anterior pelvic tilt, lordosis, kyphosis, forward head posture, like flat foot, excessive cavus foot, hallux valgus is nothing but. So the first part of the first toe of the foot is going outward position. So that is a hallux valgus. Genu valgum means knocked knees. Both knees are touching. Genu varum means the knees are going away from the midline of the body. So that is a genu varum. So squinting or crossed eye patella means the patella are like the upper part of the upper pole of the patella. The patella is facing towards the midline of the body, whereas grasshopper's eye patella means the upper part of the patella is facing outwards, like a frog eye. How does frog looks like? Frog eyes are rotating outwards. So that is how the grasshopper eye patella looks like. Scoliosis is another part of the uh, postural deviation. So the spine curvature is shifted to one side. Either it can be right side, either it can be left side. So these are some kind of postural deviations which can be seen. Okay. So whenever the person is bending his neck forward more repeatedly, so he's going to have more pressure on the posterior part of the neck. Either it can be at the neck region, either it can be lumbar region as well. So you are bending your trunk repeatedly for a continuous, or you can say prolonged period of time. You are going to stretch your back muscles continuously, and those muscles will get weak, as well as you're contracting muscles, front muscles continuously in a shortened position. Those muscles will get tight. So which is very dangerous thing in the long run. So that is why you have to be very cautious about your posture whenever you are in the sitting position, whenever you are using your mobile, whenever you are in front of the system. So and also you have to be careful about your athletes. So how they are walking, how they are running. So when it comes to the postural analysis, postural correction, if you go a little bit deep, so we can say running analysis. You can say it can be sprinting analysis. So those are the different topics which are the beyond scope of my topic as of now. So that is how. So these are kind of some ergonomic aids. How the person is sitting in front of the computer. Your eyes should be exactly close to you, close to the computer monitor, and your arm should be very close to the trunk, and your foot should be rested on a little bit higher on. You should be. It should be planted exactly in line to your knee joint. So that is how, and your back should be rested. That is how. So you should using some kind of ergonomic uh, points in order to avoid some postural problems. So as you can see, so these are the some kind of lifting uh, positions. How you have to use your lifting techniques like back posture and good postures whenever you are using a lifting technique. As you can see, so you are not supposed to sit forward whenever you are using the lap. Or you can use any system or laptop, anything. So your back should be straight, your eyes look forward exactly to the monitor, which should be your eye level. So whenever you are bending knees and lifting the heavy weights, so which will make you less vulnerable to have problems at your back region. So when you bend your knees and lifting, so that is very good. But you are not bending your knees and continuously you're bending your trunk as well and lifting the weight, so which is going to put more pressure on the back region, which can cause disc problems as well as muscle strains as well. So you can see, so these are some of the diagrams. So but eventually what I would like to say is that postural correction, like, you have to be, it's not a simple thing to say to strengthen this muscle and stretch this muscle. So it is better to go through the postural analysis. If you find out that this athlete is having some problem, so you can do postural analysis, postural evaluation by the physiotherapist in your center, so that they will tell you exactly so what kind of posture he is having and which muscle is having tight and which muscle is having more weak, so that they can give you a plan, they can give you a blueprint exactly according to the individual, according to the each athlete. It should be customized. It's not the general way, but more or less, as I said earlier, that like forward head posture is one of the important things. So that is how you have to strengthen your, especially upper back muscles, especially scapular retractors and the middle fibers and lower fibers of the trapezius. But when it comes to front neck region, you have to stretch your entire front neck muscles. But when it comes to lumbar region, you have to stretch your hip flexors and strengthen the hip extensor, like gluteus maximus, those hamstrings. You have to maintain good core of the entire abdominal muscles. Like you can say, dead bugs exercises are there, planks exercises are there. So those are kind of exercises. Not only those two, so many exercises are there. So those exercises can be incorporated into your daily, 2 to 3 times in a week. So that is how you should maintain a good proper posture every time. So you should maintain the athlete in a very well position. Like, you should have good flexibility as well as strength in the muscles. So that is how you could improve the performance of the athlete. So these are some of the sitting things. So you can avoid whenever you are sitting in this position. So this is from my side. If you have any questions, so I'm open to the questions. Thank you very much. So I just unmuted. Ma'am, you can just, if anybody is having questions, okay, they are free, feel free to ask questions. So I'm very happy to answer.
If anybody has any question, right now is the time to ask.
नमस्ते सर. हेलो.
Yes, namaste.
मैं गोपाल भाई शर्मा,
Yes, sir, you are audible.
मैं लखनऊ से बोल रहा हूँ. गोपाल भाई शर्मा, वेट लिफ्टिंग कोच.
Yes, sir. Yes, sir.
हमारे वेट लिफ्टिंग में हम जब न्यू इंडक्शन करते हैं तो एक्चुअली उसमें कुछ बच्चे हमारे जैसे हाइट के भी हम बच्चे कुछ जैसे 165 170 सेंटीमीटर के आसपास की जिनकी हाइट होती है बच्चों की, तो उन बच्चों में हमने देखा है कि जैसे हम उनको धीरे धीरे मस्कुलरिटी मतलब फिजिकली कैपेसिटी उनको जब ट्रेन करते करते उनका जो हम उनको उनके मतलब अकॉर्डिंग टू लोड लेके जाते हैं, तो अपर पार्ट जो जिनकी हाइट ज्यादा होती है उनका थ्रोसिक काइपोसिस वाली जो प्रॉब्लम है ना सर, तो ज्यादातर जब वो क्लीन करके जब वो उठते हैं तो उनका अपर पार्ट जो है थोड़ा फॉरवर्ड हो जाता है. तो हम जैसे उसमें हम उनको हाइपर एक्सटेंशन वगैरह, अपर बॉडी की एक्सरसाइज वगैरह देते हैं, कोर मसल ग्रुप की एक्सरसाइज भी कराते हैं. आपकी तरफ से ऐसा कुछ और सजेशन है जो हम उसको और बेटर तरीके से बैलेंस कर सकते हैं, क्योंकि उसमें ये प्रॉब्लम बहुत आती है जिनकी हाइट ज्यादा होती है, स्पेशली.
हाँ सर, yes sir, yes sir. So actually, sir, so the athlete who is very tall, na, so what you do is that you should incorporate, especially first of all, you should identify. So what is the main problem with that athlete? So if he's having more arch whenever he's doing a snatch, or you can say what do you call clean or jerk. So especially most of the time you can say snatch, na. So whenever they are doing snatch, or you can say jerk position, so few people may develop some kind of kyphosis. Yeah.
In the clean position.
Yeah, you can say clean position. Okay, so
snatch position में नहीं आती है वो.
Ha. So first of all, you have to identify which athlete is having that kind of problem. So if he is having na, so first you
Okay.
should assess them. So those are having na that thoracic kyphosis problem. So they may be prone to have shoulder problems as well. So in the long run. So why? Because that thoracic kyphosis na, so which is causing whenever they are lifting the weight, so entire that the bar rod and weight of the bar is going more anteriorly to the thoracic spine, so it is making entire back muscles elongated. So either if they have more strength in their back region while performing these lifts, so it is okay. But if they are weak, so eventually what does they do is that they have to have some postural back, especially thoracic neck extensors may get strained, as well as they may have some disc problems as well. So that is why very importantly, so we have to be more focused about the thoracic flexibility exercises. Like there are thoracic rotation exercises are there, like you can say quadruped thoracic rotation exercises. So those things can be incorporated, as well as what you have to do is then you have to strengthen your upper back muscles. Like you can say trapezius is very important, as well as you can incorporate like a Superman exercises. So like there are static Superman exercises, as well as you can incorporate some static Superman exercises, like dynamic Superman exercise as well. So when you incorporate those exercises, you can pretty good at preventing the injuries, as I said, rotator cuff muscle strength is also very important. So that is how the entire, so the upper body kinetic chain is interconnected. So that is how you can prevent the injuries.
Okay.
I hope I answered your question.
Thank you, sir.
Okay, you are welcome.
Yes, sir. Very good. Thank you, sir.
Okay, sir. If anyone is having questions, please feel free to ask.
I guess there is no more questions. First of all, I like to thank you, Dr. Shobhan Babu, for such wonderful session. And I thank each and every one of you to join
Thank you very much.
today's session. So thank you all. Take care.